Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about Medicare savings program in our healthcare domain. Guys, before that, if you are watching our video first time and if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and turn on the notification so that you will get every our video as a notifications to your desktop or mobile. Okay guys, before we discuss about Medicare saving programs, we have to understanding the concept of poverty level. Here the poverty level or poverty line is an important benchmark for determining income eligibility for various government programs and assistance. So simply it will be telling about eligibility of income eligibility, so that they will calculate the income eligibility so that the government is helping to them who is under the benchmark of that income level. In the year of 2025, the federal poverty level for a single person, nothing but individual in the United States, is $15,650 even annually, and for a family of four people it is around $32,150 even. So the person who is below this benchmark of income eligibility is known as a under the nothing but below the poverty level individual. The family or individual above this kind of amount of eligibility benchmark is known as a above the poverty level. Here, this benchmark of poverty level will be determined by the US Department of Health and Human Services. So here the poverty line refers to the income threshold below which individuals or families are considered to be living in the poverty. So the people who are below the poverty are eligible for a certain government assistance programs. So nothing but we have to understand that the people under the poverty level are eligible for a government funds. So government is helping to the people who are under the poverty levels. Why? Because those peoples are not eligible to pay the premiums to the insurances also. So for that kind of people will be determined by the US Department of Health and Human Services and providing the funds to those people. These funds or these programs often include reduced or free healthcare services and insurances. So like that, in states, it will be the poverty level will be changes to state. It will be not the same because the cost of living in particular state is different from to other state. Like that, the poverty levels and income eligibility benchmarks also vary to state. So we have to understand that the Medicare saving programs is also type of government assistance programs. Nothing but here the state government programs are helping to pay the premiums to the Medicare. So that is why the Medicare saving program will be comes into the picture. We will discuss in the next slide. Okay guys, now we are discussing about what are Medicaid saving programs. These Medicaid saving programs are federally funded programs. These programs help for Medicare cost. So and also this Medicare saving programs are help for Medicare Part A and Part B premiums, deductibles and copays. So we have to understand that these programs are funded programs just helping to the Medicare and Medicare cost. So there are people who are not able to pay the premiums for Medicare Part B or Part A premiums. For them, these programs are giving assistance or giving funds to pay that kind of premiums like part A or part B premiums, and also cover the cost savings, nothing but deductibles, copays, and co-insurances. So like that, this Medicare saving programs are helping to the people under the poverty line. Okay, now we are discussing about Medicare saving program eligibility. Are the people who are apply for Medicare saving programs. So to apply for Medicare saving programs, the eligibility criteria is the individual or the person must already have or be eligible for a Medicare Part A. So if that person is eligible for Medicare saving program or to get the benefits of Medicare saving program, he should be eligible for a Medicare Part B. And the second point is income must to be at or below the federal or state limits for the specific program. So your income is a matter. So that income must be at or below the federal or state limits for the specific programs. So your third point is the resources need to be below the federal or state limits where you reside. So where are you staying depends on that particular state. The income and resources are like very important points to be considered for your eligibility for your Medicare saving programs. So we have to understand that there are the 3 points majorly very important to be eligible for Medicare saving programs. One is that person should be eligible for a Medicare Part A, and also income should be under the limitations of that particular state, and also resources also be under the limitations of that particular state. Guys, to be eligible for Medicare saving program, there are a few important points to be noted. The point is income and asset guidelines. So based on your income and what kind of assets you are carrying, the, those things will be very important to be considered as a Medicare saving program. So it is like resources counted. For example, you have a few kind of resources like money in a bank accounts and savings, I mean saving accounts, and also stocks if you are invested in a stocks market, like money in the form of stocks and also the bonds. These resources are counted for Medicare saving program to be eligible. And if you want to participate in a Medicare saving program, some kind of resources are not counted. For example, your primary residency house and your one car or primary car or your one car will be not counted for your Medicare saving program. And burial plots will be not counted for that uh, Medicare saving programs, and your household and personal items and your house furniture will be also not counted for a resources. The only the money and bonds stocks are considered for a resources for Medicare saving programs. So we have to understand that the limits of will be changes from state to state to be eligible for a Medicare saving program. Guys, based on monthly income and asset limits of that particular individual or that particular person, there are a four type of Medicare saving programs. And also this income and asset limits will be not the same for all states. It will be vary from state to state, but we have to understand that there are a like four plans are categorized. The first one is qualified Medicare beneficiary, also known as a abbreviated as a QMB. So this QMB plan is nothing but the person who is eligible for Medicare and Medicaid benefits, and complete cost sharing and Medicare premiums will be covered under this plan QMB. And there are a second plan type is SLMB, specified low income Medicare beneficiary. So the persons, specified persons are there, they are comes under the low income. So for that kind of people, this those individuals will becomes under this SLMB plan. So we have to understand that QMB means complete benefits will be provided by the state government. SLMB means few specified low income people individuals comes. So there are some uh, things will be paid by the patients, or little amount, very little amount. That kind of specified low income individuals persons will comes under this SLMB plan type. And there is some other people who are qualified individuals. So certain criterias are there, we will discuss in next videos individually. Like QMB I will make one video, SLMB also I will make one more video. So in that particular videos I will explain briefly what QMB plan, SLMB plan, and what is the difference. So what is the individual plan, and also what about the qualified disabled working individual. So there are persons or individuals who are working and also disabled. For that kind of category of people, the state government of that, I mean whatever the particular state, that state government will provide some kind of plan. So QDWI it will be known abbreviated, qualified disabled working individual. So the individual, I mean the disabled working individuals, the people who are coming under the uh, QDWI plan type, they are getting some kind of benefits based on that eligibility criteria of that plan type. So basically we have to understand that these all type of plans are given by respective state government to help the people who are under the poverty line. So there are a, like poor people, like this state government is giving help to in the form of these programs. These are the assistance program, government is assisting to the people with the help of this kind of programs. So that is why it will be known as a Medicare saving program. Why it is called as a Medicare means they are, these programs are useful to pay the premiums of Medicare to that particular state individual persons. So that is why it will be called as a Medicare saving programs. Generally the Medicaid, the state Medicaid of that government is helping to the individuals to pay the premiums of the federal Medicare. So in the means the patient will be not responsible for the even small copay co-insurances. I think there are some programs are there, SLMB especially. In SLMB patient is liable for small copays or co-insurances, but in QMB plan we cannot bill even copay or co-insurances to the uh, individual. I will explain completely this information in next videos. However, we have to understand that Medicare saving programs are a four type of categories based on income and asset limit. Those are QMB, SLMB, QI, and QDWI. And we will discuss all four type of Medicare saving programs and what are the benefits they are providing to individuals in the next upcoming videos. For time being, thank you so much for your time, and thank you for your watching. Have a good health. Bye for now.